Supervisor Heidi Wegleitner wishes to speak in opposition.
Yes. Well, this is an interesting discussion, and I thank you all for your thoughtfulness, and the supervisors who are asking, I think, really good questions. And we have new supervisors here considering this project since the initial jail consolidation project was approved in the 2018 capital budget. So I think it's really important that these conversations happen again, and now that we're at the place that we're at, we're asking, what is it that we really want, and what is it that really makes sense? $186,000 for more studying of options that mostly don't sound good or realistic to anyone doesn't make a lot of sense to me. It doesn't make a lot of sense to me, especially because of all the good work we've been doing on criminal justice reform that's unfinished. And some of that was just mentioned, and the objectives of trying to keep people with mental health issues out of the jail. First point, though, is this is a huge public project, major public cost, major public interest, and I know you had difficulty trying to get this meeting scheduled, but we're meeting on election night in the city of Madison, and I think there are people that probably want to be here that probably would like to, well, they might be able to stream it at some point thanks to Private Citizen, but I don't think it's appropriate to be voting on this tonight when there are many people who can't participate because they're working the polls or because they're trying to get to the polls. So I would ask that you either refer this or vote this down tonight. And I also want to say that when we debated the project in the 2018 budget process, a lot of things, a lot of narrative was put in about the important criminal justice reform efforts underway. And also money was put in for $100,000 for, or I think maybe 125 with a specific equity component to study our mental health system. And that RFP, now that it's late February 2019, is still under evaluation. It's actually been sent out for RFP multiple times. We don't even have a resolution before us to start that study process. So, you know, and then a year ago, we got a report on a sequential intercept model about diverting people with mental health issues at various phases in the process. Really important work, interesting, helpful report, and supposedly all hands are on deck to do this. But instead of, you know, waiting for this mental health study,
30 seconds, and you want to?
I'll try to wrap up. Instead of, you know, trying to, you know, double down and look at that model and that report and look at this mental health study and actually study a crisis restoration center, we're just going to, you know, move forward ahead and keep changing this contract and have studies that don't even give us the full cost of operations. I just really wonder, what is this change order, what is this study really about? Is this really about what we want, or is this some kind of political game that's being played? And we know that $150 million jail was not acceptable to a prior county board, and I would think it would be difficult with this county board too. Why don't we think about the mental health system and diverting more people from jail, and getting the data we need that sequential intercept model says we absolutely need to fully evaluate this before we're investing this kind of money at this time. I don't think the change order is the appropriate way to do this. I think we need to have a bigger community conversation. I think we need to have you know, really look at our various options, and we absolutely need to get important data on the mental health impacts on our criminal justice system, and we don't have that now, and it doesn't seem very urgent because the RFP is still under evaluation. So,
okay, well, thank you, Heidi.
Question.
Yes, Supervisor.
I have a question.
Yeah.
So, first of all, thank you so much for being here, even though you and I have somewhat different perspectives on the jail. I so very much value your input because I find it so valuable. And I would ask you the same question I asked Sister Francis, which is, assuming you were to get the mental health study RFP'd and done and all that input and the other things you asked for, assuming that all were to happen, what would you want to do with the proposal that's before us tonight in terms of building the physical structure or not building a physical structure? Just on that part of it, assuming you got everything else paid for from the treatment and everything, what would you want to do with the physical structure, if anything?
That's a fair and good question. I think we need to look at where renovations are appropriate, but we also really need to look at keeping people with mental health issues out of the jail. Instead of making a mental health facility in the jail, as Sister Fran was talking about, what about a community-based mental health center or multiple mental health centers? We know underway in Middleton, I know because I was reading Paul's blog recently, they've broken ground on the new psychiatric hospital out there, and that will have an impact on the number of beds that we can hospitalize people in the community. Now, I'd like to have a more a less intense intervention than hospitalization, but we need a spectrum of services. So I would like to see us reduce the number of beds, look at more modest renovations, but keep people who are sick out of jail and treated in the community.